Hi, Jen.
Hey, Bethany.
How are you today?
I'm great.
I was thinking about our tennis lesson yesterday and how our coach starts off the day by saying, Happy, wonderful Wednesday.
Yes.
And I was thinking about what we're going to talk about today. And I was thinking today is a thoughtful Thursday.
Okay.
Because we are going to talk about our experiences that have made us better at our jobs. Because every career you should evolve. But in healthcare, it's vital to evolve with our experiences and personally and what we witness.
That's so true. And it reminds me of, we were talking to a friend of Bethany's, a friend of your sister's, yesterday, who's a doula, and she's a kind of a newer doula. And one of the, I think, most profound things she said was that the more she learns, the more I'm paraphrasing, but the more she realizes she has to learn,
right?
Which is,
it's such a great statement.
It's such wisdom.
It really is.
It's so true.
Yeah.
And yeah, I think so many things that we've gone through in our lives has changed us.
Of course.
And we've kind of evolved, into what we are today and who we are and sort of how we ended up doing what we're doing now.
Yeah, totally.
Do you want to start talking about yourself or should I start? How do you want to do this?
I'll talk about myself.
Okay.
Yeah, I mean, I think the first thing that is really incredible is how we even became friends.
Yes.
And it's because of our children.
Yes.
Because we met at our preschool, was it the spring party?
Is that when we first?
Yeah.
Yeah, that's when we first
met. That's when we've met.
When I ventured out, I didn't want to go. I didn't know anyone.
Yeah.
And I was like, definitely going to be there for 30 minutes. I just have to do it. Put my face out there. It was the first time I'd really been in a group event since the pandemic, since moving there. I didn't really know anyone outside of the couple people I knew prior to. And
then we ended up on the dance floor all night.
On the dance floor. But then we really connected at a dinner. A mutual friend put together a dinner for a whole bunch of couples.
Yes.
And did I come in late? Somehow,
you did come in late.
I think I came in late.
And the first thing I noticed was your sweater.
What was I wearing?
I don't know. It's like a very Jen style is grandma chic, as I like to call it.
I think I know exactly.
So you were wearing
the big buttons.
The big buttons, a grandma chic sweater. And I was like, okay, you're sitting next to me.
Yeah, I think it might have been the only open chair. Yeah. But I was lucky. I didn't know.
You didn't want to sit there
all the way at the end of the table. And I just remember sitting down and I think we realized that our kids went to the school together. We met at that event. And
then we started saying their birthdays, and that's when things started getting crazy. Because my daughter's birthday is, let me not mess this up because I did this for her school when I went to go.
I know your daughter's birthday, so you better know.
Is June 8th.
Yes.
2018.
Right.
And Pippa's.
Mine's June 14th. So
2018.
Same year.
And then our son, Sable, is July 15th, 2020. And Hank is?
July 26th.
Okay. So we're like, whoa.
Yeah. Crazy.
Okay.
Two June girls, two July boys.
Thinking about things at the same time.
Yeah. Right. And then we were, what do you do? And we kind of, obviously you had been a labor and delivery nurse, and I do what I do, which is obstetric anesthesiology. Yeah. So that was
crazy.
We just were like, oh, birth.
And then we were like, oh, what are you? And do you know this doctor? Do you know that doctor? And all of a sudden, and where are you from, by the way?
Florida.
Where am I from?
Okay, well, you're kind of from two places, but one is Florida.
Okay, well, I'm originally from Miami.
Confused me for a while.
Okay, if you live 10 and 10 years, you get to say, I'm originally from Miami, but then my parents decided to move to Cincinnati. Don't ask why.
Right, but later on when you said Cincinnati one day, and I thought I must have gotten confused somewhere, but I get it now. Right. But yeah, and you talked about your birth classes. And I have always, that got me so excited. I went home and talked to Paul and I was like, I met this girl and she does something with birth classes. And that it was a secret passion of mine. It was like something I wasn't allowed to say because I have a job. Yeah. And it's not, it's not birth classes or it's not birth education. But that was something that I always was just wanted to find a way to communicate with people outside of the patients that I have at the hospital, the individual people that I see.
Totally.
And I was always just upset that I couldn't spend more time with people. I wished I could and explain things to people a little bit better.
Well, I'm sure too, now you've had 2 babies. So even more so, it's like igniting this fire to be like, I have so much more. Now I even want to say, because I lived it and I felt it, and now I can empathize with you in a totally different way.
Yeah. I just realized how important those little interactions are with people. And and over time, I feel like I can make a difference, even little differences, just by treating people a certain way.
Totally.
Or giving them that extra few, even if it's honestly seconds or minutes of I'm listening to you.
Yes.
I'm explaining this to you. And that has just grown as a passion of mine. And so we started talking about what can we do together?
Yeah.
Honestly, like maybe that first dinner.
I know. I am actually thinking about it. Like, when did yes.
And then then we kind of put it aside. And then over time we've gotten closer. Turns out my 2 kids and your youngest 2 are super close. And their relationship has only grown over time. And our husbands are friends. And it's just, we're
all merged together.
Obviously. But then a couple of years ago, I think is when I somehow, who do you think brought it up?
I think you did.
I think I did.
Yeah.
I think
you're the bold one.
I think there were hints, and I said, Bethany, should we be doing something? I don't know what, but we have things to say. And we would, of course, have so many conversations about my job and our experiences and how we just always felt like we had something to say. And so we thought about all the different ways we could do it. Should we start a blog or some kind of, and
something we both do very well is talk at each other.
Well, then it's just, I discovered podcasting, not as never thinking I would be doing it, but just as a medium.
Can I also thank you, because I never listened to podcasts
until
you were like, you really should listen to some podcasts.
Yeah.
And then all of a sudden it is addicting.
It is, because you can learn so much.
The information is beyond valuable, and the different perspectives. And then you feel like, again, how many times I wish there were podcasts around when I was going through things to be like, somebody understands me. Somebody relates to this. I'm not just Googling and getting
it's very
sterile answer. Yeah. It's like, no, someone's like giving emotion behind it, and humans have to connect that way.
Totally. So so then we decided we should do a podcast, and here we are.
I mean,
it took a lot longer than that, but
right. But now we get to, I feel so excited every time we're going to record. Yeah. And I'm always like, and utilizing to like what our friends say to us that they wish we would talk about, or the things that they felt unsupported in. And it's like this platform for us to get to talk about those things is so awesome.
Right. Things come up every single day.
Every day.
And so I think what started this conversation that we're having today was, again, the conversation we had yesterday. And it was in speaking about doulas. And you had tiptoed into the doula world at one point, right?
Yeah, before I went to nursing school. I was changing careers, so I was like, if I'm going to go really back into school again, like I should probably know I really enjoy doing this, and that's why I initially became a doula. So
you went to school to be, knowing you wanted to do labor and delivery.
Yeah.
Is that right?
Yeah.
Oh, wow.
Yeah. And then it just morphed into it, because the first hospital I worked with a midwife, and she would, call me and be like, okay, someone's about to deliver. Do you want to come and be a part of it? And of course I said yes. And the one thing I loved her. I loved her style. I learned so much from her. But the one comment she did say to me that has always kind of been like, it irked me a little bit in the moment, but even more so now, she said, because I really respect doulas so much, is if you want people to respect you, you got to go to nursing school. Yeah. And I do agree with that, but I don't agree with that. It's a mixed
What does that
statement
even
for
mean?
me.
There's they're totally different roles.
Who do I want to be respected by? Like the patient, you as a midwife, the
doctor,
OBs, like the anesthesiologist, like who am I trying to
impress?
Yeah.
I mean, you're going to do what you want to do.
Yeah.
Right?
But I mean, at the same time, it did make me go to nursing school, and it did create a path for me that has landed me today in this chair.
Yes.
With you. So, you know, but it's like, you know, one of these comments I was kind of like,
so that, and that comes from somewhere. And I can admit, and that's what I was talking about yesterday, was that I did have, you know, as someone who wasn't a mother, who had never had a baby and just was so hyper focused on the medical side of things.
Yeah.
I looked at doulas as what I didn't understand their purpose. And I was sort of, and this is definitely was something I was told to me more than something that would just come out of thin air for me, was that they were in the way, that they were sort of, you know, giving medical information when they shouldn't be, and maybe giving misinformation. And that's a big thing for doctors. You know, we are always fighting against misinformation. And
I wonder if someone had proposed to say that they are the emotional side of supporting a patient that is imperative.
Right. No one said that.
Exactly. That it's imperative for like helping a patient out truly, to like really see all sides of what they need to be supported with.
Right.
And the medical
kind
side.
Of talking them out of medical interventions or something.
Right. Right.
Yeah. And so I was, you know, when you're in training and you're learning and you're especially working at a place where bad things happen enough that you're just so worried about about safety, which is so important. But I didn't understand that you could have safety and
support,
emotional, physical support at the same time. You know, it seemed mutually
like in medical school,
exclusive.
this was never intertwined in any of your...
No, and not rightly so, but it's to go into how I want people to see or understand doctors. It is such I'm just realizing this now. It's such a long road, and it's a bit, you know, abusive, maybe not the right word, but certainly
you really put your time in.
You are really putting yourself out there and sometimes being treated poorly. And talk about respect. Well, a medical student or a resident, as you go up, you know, there's such a hierarchy in medicine.
Of course.
And
which is one of the biggest problems. May I just say that?
Yeah. And forever you're at the bottom and you're at the bottom.
Yeah.
And people are telling you what to do and telling you you don't know what you're doing. And so you just, there's a lot of sacrifice. That's the word that I was looking for.
Okay.
There's a lot of sacrifice of your time. There's sacrifice as far as, you know, where you're going to live depends on where you get into school or where you get into residency. And you are worked really hard for not really, well, in medical school you have to pay them, you know?
Right.
And you're constantly like trying to win other people over, trying to get to the next level, pass this test, impress this person,
feel respected,
so that you can keep going. Yeah. And then the farther you're in it, well, you can't go back now because you've done this much. Right. And so you just have to keep going and going. And in a way that kept me moving forward, and being out of that is part of why I've really wanted to take on doing something a little bit outside of clinical medicine, because I'm so used to what is the next step? What is the next step? Yeah. And then suddenly you're done. Yeah. And it's like
now what?
What now? Like, there's no test to take, you know, there's no one else to, you know, there's no other higher level than this. But anyway, there's just a culture of medicine that I think is getting better. And, you know, there's more women but there's still not a support system for, the medical system was set up for men, for,
Right.
Who are not taking care of children,
Right.
who are not mothers.
Right.
And
They didn't care those
so there's
babies.
still a big disconnect between how can women do this type of work and be mothers.
Yeah.
And it's just not set up for that at all. So there's a lot of kind of disgruntled, there's burnout. And
it's just the irony behind it is just so crazy to think. It's like, here's a category that is about providing like a better human, a healthier human, but yet we do everything in this like opposite way almost. Like we're not treating the whole human.
Right. Yeah. And there's just, it's we learn so much, and we feel like we studied all these things and we've seen so much. And by the way, also seeing so much heartbreak and so many sad things over time, I think does something to a person.
Of course.
And so our goal is just truly, even, almost a lot of doctors are good people, is all I'm saying.
Yeah.
But something happens somewhere where we are not seeing the forest from the trees. Like we are just so hyper-focused on doing our job and keeping the patients safe and being so prepared, especially with anesthesia. Anesthesia is a field where things are fine until they're not. There's things, and what makes us good, what makes us good at our job is being able to anticipate things going wrong because it can happen at any moment.
Right.
And that's what we're really there for. We're not there for, when everything's going right.
Right.
And so that mindset kind of sets you up for just being so hyper vigilant and not understanding what else matters for the patient. And birth in particular is just so different because it's
so emotional.
It's emotional, and it's an experience that's so important for, it can be so happy, and it's just so different because it really combines that emotional aspect. And it's such a team sport.
Yeah.
Which is
also the magnitude of it's 2 lives that you're in charge of.
Right. It's just a lot. But I love it so much. So how did we get into loving birth? So how did you knew you wanted to be a doula, or you knew you wanted to go into birth. So what triggered that in you is what I want to know.
At a very young age. This is almost like a
kind
weird,
of like you were going to be a mother.
Yes. This is kind of a very bizarre story, but do you remember when like the salesman would come by your house to sell the encyclopedias? Did this ever happen to you? Okay, well, we had a salesman come by our house and sell us a bunch of encyclopedias.
Yeah.
And, this is pre-Google, okay?
This is clearly a while ago.
Yeah, this was a long time ago.
Pre-Wikipedia.
Yeah, this is when you had to look at a book to get information.
Yes.
Anyways.
For your research papers.
Yeah, and I don't know. I had gotten in trouble one day, and my mom was like, go get one of those encyclopedias and write about, just open it up and write about it or whatever. Anyways, and I was like, okay. And so I walked over. I get it's going to pull everything in today. I just can't believe I'm telling this story and I'm thinking about how I'm ending the episode. Anyway, so be full circle. You'll understand it when we get to the end. But I randomly pull out this book and I start flipping through the pages, and I happen to come across pictures of a vaginal birth. And,
How old were you?
I don't know, maybe 10, young.
Yeah.
Okay. And anyways, I was so intrigued by it, and it was like a carousel of photos. And so all I'm doing is looking at it and reading the information, and I was just
a little X-rated photos.
Maybe a little bit. Maybe a little
has
bit.
to be.
But I just thought it was so cool.
Yeah.
I just thought it was so cool. And I think that when you have a passion, sometimes
you
can't
the talk yet.
No. Okay. No, I don't know. So, and then also too, my youngest sister's 13 years younger than I am. So that also is I felt like she was like,
how did she get here?
Yeah.
Well, I guess she wasn't there yet if she's 13 years younger.
Yeah, no. Like, okay. I mean, at that point I knew how she got there, but I got to like witness my mom. Like I was intrigued with her pregnancy and I was old enough. I was 13. I was old enough to, 12, I guess.
Yeah.
To ask her questions. And it would like kind of like brought all these pictures in the book that I had seen. And then I'm witnessing it in my mom. And I actually wanted to go to her birth.
You did?
I did.
Did you?
No.
Okay.
And I was in school, but my mom said like if it ends up happening on like the weekend or something, but that's how
so you were always into it.
Yeah. So and then I went to school for fashion design because I had a science teacher tell me that I was terrible at science. And so then I was like, oh, well, I guess I'm not going to become a nurse because I can't do chemistry.
This is why we can never tell our kids.
Yeah. It was my chemistry teacher.
Yeah.
Yeah. Well, yeah, thanks for driving me back into the profession.
What? You did it anyway.
I did it anyways. And it was actually a great learning lesson in life was I wish I would have taken that challenge and not let that teacher's comment that he, said to my mom that it pushed me off my path. Yeah. But I came right back to it.
Yeah.
And it was when
later on. How old were you when you took that first doula?
Oh my gosh. Okay. So.
Were you married
22, 23, like new in the city. I mean, I moved to New York City.
You didn't do fashion for very long.
No, I hated it. I loved it until I started working in the industry and I was like,
not for you.
Oh, these people are really mean. And if I'm going to get yelled at, I'd like it to be over like a life and death situation, not over the yardage that wasn't ordered, and that's truly what made me be like, okay, I have to shift this up. I don't feel complete. And then I started looking into becoming a doula, birth doula. And then off I went.
And then you've just been in it ever since.
Yeah. No, it just has evolved, right?
Right.
Like it's evolved in how my life has kind of unfolded too.
Right.
With different experiences.
Do you feel like you feel any different about birth since having your children?
Oh, totally. I mean, I almost wish maybe I'll go back to being a birth doula when the time is right, because I think I would be...
You would be so good.
Oh, I would be so much better. I mean, I think about it now. It's like, I mean, I was super supportive to those women, but like...
You're like a friend
partners. Well, if you have another baby.
Yeah.
But I now, again, with wisdom and with knowledge and learning and seeing experiences, I think how much they'd really trusted me because I wasn't a mother yet. I had never gone through birth. But what I could provide to them was an understanding of what
compassion
and being supportive and holding their hand and talking them through it. And
there is such an element of once you've experienced things. I've talked about this a lot, but because I've had, a C-section and a vaginal delivery and I had an epidural and I have had a spinal and I love being able to tell the patients that I have experienced this myself.
Totally.
Knowing that no one's going to experience something like exact way that I did.
They can connect with you.
But I also can even, I mean, for example, like let's take a spinal or an epidural, how it really didn't hurt for me. And so I know that's possible. And I know that's not always going to be the case for someone else. But I really... It matters to me when it's really super uncomfortable to have it put in because I feel like I can improve what I'm doing to make it not hurt as much. Like what else can I do? Because it doesn't have to hurt this bad.
And I think epidurals do make people nervous. It's like you're like, oh, I don't want to move. Like you're like you tell me what to do so you can do your job perfectly.
I get the comment all the time when I'm talking to patients before they're having a C-section. I'm only really nervous about the spinal. And I'm like, I know. I'm sorry.
Do you talk to patients more now about what you're doing prior to you having children? Like, do you like more information?
I have just changed how I say things.
Okay.
And just more from experience, I know that some people want to know more and some people want to know less. So I get that out of the way right away.
Okay.
How much do you want to know? Like, what can I do to support you through this process.
Oh, I love that statement.
The one thing I tell absolutely everyone is I'm going to tell you before I start.
Yeah.
Because that's something, if you're sitting up waiting for your spinal or your epidural and you don't know, like things are going on behind you or setting up.
Yes. Yeah.
And you're sort of readying yourself and you're wondering. And so don't worry, I will tell you before I start. So you can, not that that's going to make you not nervous right now, but at least.
Do you feel their body language change when you say that? Like, it's like, oh, okay.
I think it's one of the more, I have a lot of little phrases that I use kind of frequently, but that's one that, I think I can get that fear out of the way that you're just going to suddenly feel some kind of pinch or sting or whatever without any preparation. So do you want to?
I want to know when you got into it. What made you? So we know we didn't have a traveling salesman come to your house.
I'm going to bring it way back.
Okay.
So birth took a while. The whole birth space took a while. But when I was this is way back. This is college.
Okay.
So when I was in college, I always knew I wanted to be a doctor from high school. And when I was in college, I'm taking all the required classes, but
like from your freshman year, starting right in your freshman year, you were like, okay. Because I would assume you have to set that up. Yeah.
Yeah. But I sort of was like, who knows if I'll even get into medical school. Right. I've had a lot of naysayers as well throughout my life telling me there's no way. There's one person in particular I remember, saying I would never be a doctor. And
the best teachers are the opposite teachers. The people who like challenge you and tell you things you don't want to hear, I think are actually the better teachers because then it drives you.
It drives.
Like, I'm going to prove you wrong.
I'm going to prove you wrong. Yeah. That's when I decided like for sure I'm going to be applying and taking my MCAT and doing all of that. But I started to volunteer while I was in college at a hospital near my college. And it was through a friend. So I had some kind of connection where a lot of the kids in the college who were interested in going into medicine would volunteer at this hospital. And it happened to be in an ICU. And so that's what it was. And I would get up at 4 a.m. and go. So this was just my training to just do crazy stuff. I was always doing this. And I'd be like out until I'd be out at night and I'd get up. I mean, don't worry, I was restocking shelves. I wasn't touching anyone. But it was basically just watching what was going on. And it happened to be an anesthesiologist run ICU.
Interesting.
Which ICUs can be run by medicine doctors who are trained in critical care or surgeons or anesthesiologists. But this one happened to be run by an anesthesiologist. And it was just such an exciting environment for me. And I loved the ICU. It's such a collaborative environment. So like the nurses are so good and so involved. And then you have the surgeons if the patients are having so many different teams of doctors have to work together for this critically ill patient. And so when I went to medical school, I thought maybe I would do anesthesia because of that experience. I thought about critical care and anesthesia. And then I changed my mind 100 times throughout medical school because I started just saying, well, okay, I want to have a life. So what specialties? I just like looked at the people in the hospital and I said, who looks happy? and I so I wanted to be a dermatologist at one point. I thought that would be fun. And eventually I made my way back somehow in my last year to anesthesia, but with the goal of critical care in mind. And it seems so different, but it's actually, it makes so much sense because compared to other types of anesthesia where the patient, obviously is asleep and there's not a whole lot of interaction other than meeting them right before they have surgery. That's the nature of the job. That's different from a lot of other types of doctors. And versus critical care, if the patient's very sick, you may not be talking to the patient, but you're talking to the family.
True.
There's a lot of talking. I guess I do like talking. that has to be done. And sort of longer term relationships with people, whether it's the family or the patient themselves. And so as I went through anesthesia residency, I decided maybe not critical care, although I still liked it.
Mm-hmm.
And I just discovered obstetric anesthesia. And actually, I do remember also in medical school, there was someone who came to speak to us who was an obstetric anesthesiologist. And he said, it's the only time you're going to get thanked as an anesthesiologist is when you put an epidural in.
That's a very bold statement.
And I do like to be
so
thanked.
True. Well, who doesn't when you work hard at something?
But it's true when usually if you're doing anesthesia for a surgery, everyone's like really happy with the surgeon and thank you so much. And we don't really get that, which is fine. But with OB anesthesia, when you're taking care of women in labor, you definitely get that. Oh, thank you so much. That was amazing. You took away my pain or you helped me in my time of need. Yeah. And that really like gave me a fire inside of me, that part of it. Mm-hmm. And so I decided that was, and I think just being, I think a late 20s woman, and I love taking care of women and I related to a lot of these people and I just loved making those connections. So then I didn't even know how much I would love it until I decided to do an extra year to do the fellowship. Okay. That was sort of just I don't know. I wanted to specialize in something. I felt like I wanted to be really good at one thing.
I also have a question. Do you feel like there needed to be more women in that particular? There's
already a lot.
Okay.
It just tends to be that way. And gay men too. I know it's true. But because people are choosing this field oftentimes because they want to relate to women.
Right.
And that year was just the greatest year because I could focus just on taking care of these women, just learning and perfecting my skills. And that's the year when I really started to think about how much I wanted to help with educating patients because it drove me crazy that even being the type of person that I am, the reality is on a busy unit, there's not, you're pulled from one place to another.
Right. There's not adequate time to have those conversations that you
women
want to have.
Right. And they're coming in labor or whatever, or just in such a mindset that this is not the best time to be educated on something that's kind of important and is going to affect you imminently.
Yes.
And you have to make choices and sign consents. And even though I'm sure, and I sort of took a birth class, but I can't remember. I probably fast forward through anything that had to do with anesthesia because I was like, I know this, but I don't know. I just, regardless of if none of these people had taken classes or anything before, I just felt like people came in always with tons and tons of questions and I didn't have enough time to properly answer them.
Yeah.
So that's when I first kind of got the bug.
Yeah.
Of I wish people knew more about this. And you can't know everything. That's the thing. I'm never going to be an OB and
you can be hungry for knowledge.
OB is never going to be an OB anesthesiologist, and we all have our own subsets of knowledge. But
that lane,
there's some basic things that I think are missing that I just had this urge to fill. But back then was when
you keep saying back then, we are not that old, Jen.
Okay. Well, I was like 8 years ago, 7 years ago. But this is how my perspective has changed in regards to kind of that holistic vibe. So I knew that I wanted to give, there was some education on the medical perspective that was lacking, but what I was lacking was understanding how there's this, how do I put this? The success of our medical interventions also has a component that could be improved with a more holistic outlook by actually bringing patients' anxiety down.
Totally.
I will give you an example.
Okay.
When we put in a spinal anesthetic, it goes, you want it to numb to a certain point in your body. And someone once told me when patients are hyperventilating, it might go up like a little higher than when they're not.
Interesting.
And I said, I don't know. Is that really true? But now I made a big point of making people calm anyway while I was doing the spinal. But then it gave me, if that's true, which it could be, if you're breathing in a certain way, that's going to change a lot, about your physiology. And so if you can be more calm and more relaxed, this can also be beneficial from a medical perspective. Like you're not just like, this is a human being. Like this is not just, it's not a like lab work, where we know what dose to give or what medication. This is a person, and everything about how they're experiencing that event, I think, affects the outcomes.
Totally agree with that.
Over time, as I've tried to incorporate just honest, like kindness and making people feel better.
Well, just in the tone that you speak to someone, if it comes, you hit someone with information differently. If you're talking at them versus talking with them,
right,
you digest that information differently. I always think too, it's funny how like Eastern medicine, like it's just, I feel like we now have this platform that people recognize how it can be intertwined into.
It has to be. It should be, yes.
And like why meditation is so important. Like these are things that have been practiced for thousands of years. Why? Because it works.
Right. And in addition, there's never taking away from all of the advances that we've had in medicine, and we continually advance. We're always learning. Like the comment, about as I learn, I realize how much more I have to learn. Yes. That's me too.
Yeah, all of us.
Every day I have a new experience. Every time I'm at work, that gives me a new perspective. And you should be continuously evolving and learning and sort of honing your practice to make it better, and understanding the different types of people and what might work for one person versus another person is just such a huge thing.
Yeah.
So now I see if I can't do it, if I can't be, I tried to bring out the doula in me, and if I can't, because that's the reality, the healthcare system has so many issues. There's so many systemic problems. So I talked about a little bit about how our training probably affects us, and then how there's this element of provider trauma where you kind of get hardened after you have to get through seeing bad things all the time, and then just pick yourself back up and keep going. And of course, over time, you're going to get sort of numb to things.
Totally.
And that might look like someone who doesn't care. And it's might be a protective mechanism.
I think so. It's funny. It's reminding me of a story when I was in nursing school. I was in the ER, and a man was brought in, who's middle-aged, had, collapsed on the sidewalk, and they were like, we're initiating CPR immediately. And they're like, bring over one of the nursing students because it's so tiring. And all I could think about when I was doing it was I was looking at his hand and noticing that he had a ring on. And I was thinking to myself, as we're counting him, or there's all these people in the room, it feels.
And how can you be effective if that's what you're thinking?
It's also like, it's also a chaotic situation, but also not at the same time. And I remember when the doctor called it, because I think we had done it for at least 10 minutes, and, the epis and the this and the that. And it's like, he called it. And I couldn't stop staring at this man's hand, knowing that he was married, thinking his wife doesn't even know he's here and that he's gone. And I barely got out of that room, and I was hysterical. And that was one of those moments I was like, can I do this?
Multiply that by 1,000,000.
Should I do this?
Yeah.
And it really was this like moment that I stopped. And I remember the firemen had come in and they were all like standing there. And I just remember them all like staring at me hysterically crying. And I was like,
is she okay?
Yeah, no. And I was not.
You weren't. I bet you
I was not. But it was, but I can, that very small piece of something I experienced, I can't even imagine when you're in this, and especially when you are working with women and babies and you see traumatic situations. Like when I lived my trauma situation, like nobody was giving me a hug. No one was giving me the emotional compassion that I needed. But on the other side, maybe just they could not because they couldn't do their job if they
went and cried with you for 3 hours.
Exactly.
Or what, you know, and you don't know, like, did they go home and cry for you that night?
Maybe. I know. So, you know, I think that this is a good lesson. You can't always judge. You can't be so judgmental. You have to really look at the full picture. And in a moment, it's easy. It's human nature to judge. That's just
it doesn't make it okay.
Right.
It's just
there's layers.
I don't know
to
what we can do. You know, there's a lot we can do as a society and as a medical system to give people breaks after something traumatic has happened.
Yeah.
But so far we're just not so good at that, and we're overworked and we're tired, and
well, even that day my professor was like, okay, so now you need to go over there to that patient. And I was like,
yeah,
I'm still like coming down from that experience, but like, sure. Okay.
And
I'll go check out what's going on.
Trauma could be something as horrible as death, or it could be just, you know, seeing someone in labor who's in a lot of pain and is scared, let's say, and that everything is fine. But it's just, you're seeing people in these situations that over time they kind of build up, and it affects you in ways that you don't realize.
Yeah. But that's where it goes back to like the importance of a supportive person in any environment, but especially in the birth space.
Right.
Having supportive people around you, your cheerleaders, whether it's a doula or if your partner, you know, your partner is going to be that person that you need. It's essential.
But yeah, so going back to the doula thing again, how amazing if I can't be there for that person, how much better would I feel if there's somebody else who is giving that support?
Totally.
And
do you feel like it would even make you like be a better doctor in that moment? Because you know you're clinically taking care of a patient a certain way, and someone else is clinically taking care of a person.
I think it's the same with every single person who works on a labor and delivery floor, whether it's a nurse, an OB, everyone who's helping the OB, if it's a midwife, if it's a doula, everyone has to collaborate, which is difficult. That's just hard. It's hard for everyone to be on the same page at the same time. But that's why, but when you can do it, it's so beautiful, because that's what patients really need. Yeah. They need everybody to take what they have to offer and do the best for their patient in that way.
Like a big soup. Yeah. You're like, put yours in, put yours in, put yours in.
Yeah. And we all have to appreciate and respect each other's roles. And it's so important. And bringing it back to the ICU, it's the same type of environment where there can't be one person who is like the ruler making all the decisions on the medical team. You know, everyone has to work together, understand the plan, and do what they can do to support that patient. And a doula is such an amazing addition that I wish everyone could have that.
I do too.
Yeah.
It's ironic because I now think about it, I'm like, why didn't I have a doula?
Yeah, I'm so surprised.
Because I knew I was going to have C-sections. I didn't, and when I was practicing as a doula, I was never allowed in an OR. Like that was like never going to happen. And so I had that in my head, and like I didn't even consider it. But what I should have considered is, what about the pre and the post? Maybe if that doula couldn't have been in the room during the operation, what about helping
your
my
gentle
partner?
Recovery?
How about all of this? Which is why we're now where we are, and we're creating these changes that we can be a part of in allowing women to see that it is possible. Even maybe if something isn't like that doula can't go in the OR, you still need them. You still need that support.
Right. And also just, with the whatever, talking with them, going into it, and maybe making a plan to advocate for whatever it is going into your C-section or communicating with a family.
And honestly, just having another woman next to you like that. So doula is a Latin word, and it means a woman's slave. Oh. And so, but when when we go back in history, right, and we understand, it's like, well, that's essentially like what was happening is that women were helping other women have a baby because they understood it.
Right. Because we also used to, going into parenting was more of a collaborative event than it is now.
Oh, yeah.
And birth was the same.
Yeah.
I'm sure.
Yeah. Okay, something I want to talk about is something that I have learned that is so important is understanding someone's privacy.
Okay.
Like in the hospital. Okay. And I have a story that I want to tell you. I'm shifting.
Okay, fine.
I just reshifted. But I think that the two biggest things that have helped me through my experiences is addressing the privacy of a patient and the pain of a patient. Mm-hmm. And when we're talking about, I think doulas, like, again, it's like, I remember covering up a woman, like just certain little things that you're like, you just move the gown down 6 inches and now she feels better. And when I was in the hospital with Sawyer and I had a lactation consultant come in because she was having a hard time latching, I somehow ended up in the room alone with just my father-in-law, who was sitting in a chair at the base of the bed. And I, have Sawyer.
Were you breastfeeding?
Well, I had asked for a lactation consultant to come in.
Got it.
I didn't realize, like, Matt and his mom
at that time,
had left the room to go probably get something to eat, and so it was just my father-in-law and I in the room.
Right.
And that's when the lactation consultant came in, and she was an older woman, and she was like, okay, like almost didn't recognize that he was even there, which I still don't really understand because it was like
Hopefully
maybe that much of a distance from the chair to the bed, whatever. And she was like, okay, let's get this started. Let me help. So she took my gown down, and I'm instantly oh my God. Even if this was my dad, this would still be super awkward. But the fact it's my father-in-law, even taking it to a whole nother level. And really, she's moving my boob around, trying to put it. And then she's like, you know what? Let me try something else. And she took my breast and started milking it and had a little spoon.
Could he see?
Yes.
What?
Yes. And I was like, what?
What do you say? Get out!
I really needed her help. So I'm like,
no, but to your father-in-law,
Well, at that point, it's it was happening too fast that I couldn't advocate for myself to have my father-in-law be taken out of the room. But literally, she's putting a little colostrum on this spoon and then trying to feed it to Sawyer. And I just remember thinking, when I get back into the profession, doing this again, the first thing is to also educate other people who are coming into the room to help, be mindful of who is in the room when you're going to help, assess the whole room, not just the patient, not just the baby, the entire environment.
Situational awareness.
Yes. Correct. So I don't really look at spoons the same way after that situation because
but yeah.
And I felt bad for him. He also felt, I just remember he was like, I don't think he moved it in. She was like, oh my God, should I look? Should I not look?
That's an extreme example. But even in the operating room, there are times when, especially in a situation where a woman doesn't have full movement or, there's some restrictions going on, even if you're in a quote unquote comfortable, let's say it's all nurses and doctors, and let's just say they're all female.
Yeah.
Even so, you don't want a boob hanging out for no reason.
Right.
It's just be aware and pull it up. And that's definitely something that I've from being a patient,
Totally.
absolutely understood.
Totally.
You know, and granted, there's also, it goes a little bit to the wayside when you're, after you have a baby and like before you have one, maybe you think that, it's just a little different. Mm-hmm. But I mean, I also have seen women walking around hospital rooms completely naked. Okay.
Might just be their
thing. So it goes both ways, as with many things.
Yeah.
But yeah, it's just respectful, and we have to treat people with respect and
people's body with respect.
How we talk to people, how we treat their bodies, consent, all those things are, you would think, would be givens.
Those are not textbook teachings, though. Were you ever?
I think it's focused. There's a bigger focus on it these days.
Okay.
Yeah, for sure. I mean, I hope.
Yeah.
But only because really bad things have happened. Things have come out in the news where, they talk about obstetric assault, real stuff. And which reminds me of the idea of birth. Birth trauma has come to, becomes a topic I'm very interested in.
Same.
And I think about that with everything I do, because even when, the medical part goes okay, or there isn't a major complication, people still can come out of situations with birth trauma, which can be really debilitating. Yeah. And, if we're as doctors, as nurses, if our goal is to take care of people and to make them healthy, but they're coming out of this situation with this horrible trauma that they're having to go to therapy, and they're just, it doesn't stop when they leave the hospital. Right. And so being super mindful of that. And this is something that I do think a lot of people are talking about now.
Yeah.
But not enough people have gotten the message.
Yeah.
And when you can imagine someone else's trauma and just thinking about your own trauma, when you're seeing people in these situations, you tend to just make it a bigger deal and really realize that taking the best care of this patient also means, as much as you can, reducing their risk of trauma. And just keeping that really top of mind has been something that's
because everyone
totally
has stuff,
evolved for
right?
me.
Of your past that could come up. They don't have to, and a lot of people don't verbalize that, and until it's the trauma. Then the trauma's like really like embedded, and you're like, oh wait, I maybe do need to talk about this stuff. I didn't realize it would creep up. It would come back into my life,
right,
in different ways. I know. I think a lot about it's like even when I started my birth class, it's like now that I'm a mom and I've gone through it, it's like, but it's not just a birth class. Like there is so much postpartum support of talking through. I can prep you as best as possible in a birth class, but I don't know how your birth is going to go.
Right.
And it's digesting that story and talking through things that you had no clue were going to happen, that you could have never been prepared for, and feeling seen and feeling heard. That's the full circle. That's really providing care.
Yeah. And by the way, there's this principle of defensive medicine where we do so much in the name of safety, right? So, for example, well, you can't hold the baby in the OR because what if you drop the baby and then we'll get sued, right?
Right.
Okay.
Right.
Well, what is the most, the way that providers, their doctors, nurses talk to patients, that's where you get into the risk of lawsuits.
Right.
It's when people don't feel heard. They don't feel like things were explained to them. Those are the people that end up suing, not the people with the worst complications. If they were treated right and they trust their healthcare team and they treated them with respect, they're much less likely to sue. So that's a total wrong way to go about things as well. I mean, we shouldn't be doing that anyway. We shouldn't be doing anything because we're worried about being sued and not how well the outcome is going to be for the mom or the baby. But it's also backwards.
Right.
Right.
Totally.
Like if you give someone a
Completely.
good experience and if you're advocating for them, I believe, you're much less likely to get into one of those situations.
Sure.
So it's something, it's just important no matter which way you look at it, I guess.
I mean, I'm just glad we're talking about it because I feel like this is what continues the cycle of change,
Right.
and that, why people telling us their stories has helped even create our topics. Like what do women feel they're not being heard about? What support is lacking in the birth space? And again, we can talk to our friend. I mean, even the other day at soccer, I'm talking to mom and I'm like learning all this information. I'm like, oh my gosh, like I never knew any of this about you,
Right.
but now I see her in such a different light. And I was like, you have given me so much good context to go with. Like, I am so happy you just shared all of this. And then, you know what she says at the end? She's like, I feel better. I feel like this was so therapeutic. I'm like, I know. This is what Jen and I talk about all the time. I'm like, it feels therapeutic for us to talk about our own choice, but know that we're putting information out there that we hope people are listening and absorbing and wanting to make changes as well.
Right. And just recognizing, like the relatability aspect that other people go through this and learning what's important to you and what isn't. And if you are going to be pregnant again and go through birth again, what can we do?
Yeah. It's not shameful to say I suffered from postpartum depression.
No.
And it's also like, you say that
more
out
and
loud.
more people are saying
and then
that
everyone's
out loud.
like, I did too. And you're like, I know. Like, we all probably in some way, I'll just say this, but I don't think anyone who goes through birth doesn't have some sort of emotional challenge after.
Yes.
You're changing as a person. Your
hormones,
like, let's just chemically, like,
sleep
shit is all over the place. There's so many things. Reconnecting with your partner, the layers there are.
It's a lot.
Keep going. Yeah.
Yeah.
So
you're welcome, men.
Yeah. Seriously. But yeah, I do. I just think that if we're entering into it more to say, how can we be proactive about decreasing the trauma that could occur?
Right. So let's keep coming up with ideas and more things to talk about.
Keep letting us know what you want to hear about.
Keep talking about it. That's kind of the goal.
Yeah, absolutely. You ready to wrap it up?
Yeah.
Okay, so we're going to go back to, I know I confused you in the beginning.
We went a lot of places.
But this is very similar to both.
I didn't have my usual outline.
Sorry. She didn't have her laptop today, guys. Apologize for that. Okay, so for Jen's birthday, she had a magician come. And what is his other? He was a magician, but he was also, what would you call him? Like I don't want to say a mind reader. But
mind reader.
Mind reader. Okay.
Yeah.
So for Jen's birthday, this gentleman came, like, first he started with like card tricks and stuff, and it was so cool. And then he's like, bending spoons and blowing all of our minds. And then he's having Jen open an envelope in which she had thought about a friend from her childhood. From kindergarten. And she opens this envelope and this girl's name is on this sheet, which is so wild. So he clearly, we all identified very quickly that he knew what he was doing, and it was very cool.
We're just really gullible. One of the two.
No,
I know.
No.
The name one. I mean, there's a few that I'm just
but like this guy was legit.
Yeah.
Okay. So he had us do an exercise. Well, he asked you to pick someone out and to open a book, and then you said my name.
Yeah.
So when he grabbed this random book.
Right.
And he opened up the book and he started flipping through the pages and he told me to stop.
Yeah.
And then he stopped on a page and then he was going down through the words and he said, stop. And we stopped again.
Yeah.
And so we're going to do that today. because this book is called Self-Care. Sorry, is that coming together?
Okay, let's see.
Anyways, but I keep this by my bed, and what I love about it is that's what I do. I just open it up in the morning.
I don't have the magician's abilities, though.
Well, no, I know that. Okay. Neither do I. But I'm going to tell you to stop, and then I'm going to read whatever the quote is for you.
Great.
So,
okay. I'm kind of
she's back.
Nervous.
She's back. Okay.
Okay.
So this is Self-Care. It's called Meditations and Inspirations.
Okay.
So tell me when to stop.
Stop.
Okay. And we're going to read what we just stopped
I
on.
hope it's good. Okay.
Me too. Choose with no regret. Do what you love. Live as if this is all there is.
I mean,
you want to do it again? Or is that a mic drop?
No, that was really good.
See?
That's like very applicable to my literal life right now.
Exactly. Exactly.
I got to see if they all are, but
well, we can do it again.
No. Let's just stop there.
Thanks for joining us. Bye.